Hi, this is my third video on arthritis series. Earlier, I spoke about rheumatoid arthritis and gout. Today, I will talk about osteoarthritis, which is the most common arthritis across the globe with millions of people affected with it. And in India, about 38 to 39% people who have joint health problems are due to osteoarthritis. Now, it is also more common in women as compared to men. Now, osteoarthritis is a degenerative disease now, where the cartilages in between the joints wears down and becomes weaker, which affects the bone density over a period of time. Now, symptoms of osteoarthritis include swelling and pain in major joints like knee, back, shoulder, hips, etc. And people who have osteoarthritis, they experience stiffness in these major joints, and especially difficulty climbing stairs, or difficulty getting up after sitting for long duration, or standing up after bending down. And usually it is seen that the stiffness progresses as the day, the stiffness increases as the day progresses. And winters is it really gets worse. So how and where does it start? One of the main root cause of osteoarthritis is calcium deficiency. Now, sometimes what happens is that the blood profile does not reflect that there is calcium deficiency because 99% of the calcium of our body is stored in the bones and only 1% circulates in blood. So when the blood requires calcium, it draws out from the bones. So it's always best to get a bone density check done also. Now, the other major cause apart from calcium deficiency is the extra weight that our joints are carrying. So it's like we can easily hold a glass of water for a couple of minutes. But if we have to hold it for a couple of hours, obviously the joints and the arms are going to ache. So imagine the condition that the knee, back, and hips are going through by holding on the extra weight that it is not meant to for many hours and days and months and even years. So that leads to the cartilage damage and exposed bone, um, rub against each other, and that leads to weakness of bones and brittle bones, and that leads to the arthritis condition. And the solution that the medical science we have is joint replacement. Now, will the problem end with just one joint replacement? No, unless we address the root cause, of course. So, what should we do? We need to increase our joint health by losing the extra weight, be regular on our calcium intake, along with the supporting micronutrients like vitamin D and magnesium. In our teenage, the recommended daily intake of calcium in a day is 1300 mg. That is the recommended one. And after the teenage years, it is around 1000 to 1200 mg. When we take calcium supplements, which are synthetic, then the absorption is not more than 30%. So that is why it is best to stick to natural sources. So keep our joints healthy. Let's take care and stay healthy and prevent osteoarthritis. Thank you.